So the question is, we have almost 300 children in our care under the age of 16. How would you suggest that we approach parents if we suspect there is an issue?
Yeah, I think just having an initial conversation with a parent and just noting some of your observations about that young person is probably the first way to start. If that young person has got a mental health illness and they are within the care of mental health services, then it's likely that that young person will have a safety plan. So within that plan, you'll get to understand what triggers might set that young person off, and also kind of coping mechanisms for that young person, whatever that might look like. For example, if it's an anxiety disorder, young people will be taught different ways to deal with their anxiety. So for you as a coach, if you do have concerns, I would certainly bring it up with a parent. I would stress that it's probably nothing to worry about, especially in young people, because their lives are so changeable. They haven't developed consistent behaviours yet. So one off day for one child might look completely different to another. But it will never do harm in bringing it up with a parent, just in an informal conversation in the first instance. And then if you think it's something that might raise cause for concern, it's something to explore further, especially when you're working with young people under 16. So the NHS has something called shared decision making within mental health. So they really encourage that a young person is in control of the support that they access, so they know exactly what's happening. So they try and involve the parent and the child in that decision making process as much as they can, because often feeling out of control can be a trigger for a young person. So yeah, I guess it depends on the answer from the parent, but I would certainly bring it up in an informal manner if you can, and go from there.
And Sarah, just to say there in terms of the question, and you said you were mentioning that we've got a lot of children in the club under the age of 16. I think that is where we spoke earlier about that kind of club policy, that structure you've got in place so that the club is aware as a wider club at every level, at every coaching level, from whatever age group that you work with, from the lowest, whether that be under 7s all the way through to under 16s. It's just about making sure that the club has a wider club policy. So you've obviously identified there that you need to appoint a mental health coach. We wouldn't suggest that you need to have a mental health coach within the team, or that's something I wouldn't suggest, but I just think that wider within the club, the expectation is that all coaches have been given some informal training, or at least that the club is pushing their agenda within the club wider, so everybody understands that mental health is a factor. If they need to speak to anybody, then there are people within the club available, whether that be through the child welfare officer, or whether that be something that you link with, like you mentioned, maybe having some people who are designated within the club that people feel that they've got access to. But to stop that person from feeling like they have to deal with everything, it should be a wider club issue rather than just designated to maybe 1 or 2 people.